Yeah. So if I was sitting in the audience watching this, one thing that I would be asking myself would be, yeah, all this sounds good with the marketing and getting the patients to like you and so on, but how does it work? And then when I got to see how ClinicGrower worked, I realized that their ads, they bring interested patients in an engaging way. And I must say that I think a lot of thought went into creating these ads, and I think a lot of testing went into creating these ads, and they're incredibly effective.
If I could pitch in there and give anyone watching a helpful tip. You're exactly right, Melissa. Sometimes we forget in the Monday to Friday, 9 to 5 of the office, we're reaching out to that patient when it's convenient for us, right? Sometimes even just having the mindset of, well, we're definitely going to still reach out when it's convenient for us. Are we available when it's convenient for them, right? That is definitely something that is, 2025 most competitive market. That mindset does make a difference.
I have a lot of success on Sunday afternoons. Every single Sunday, I sit down and I send reminders for the entire week. I schedule the text reminders to go out to the patients for their appointments for Monday through Friday. People who are sitting in my steps of the funnel, or people who have no-showed for an appointment, or people who have canceled an appointment, just shooting those texts out were so worth it because this one patient made that all happen. And the amount of, billable services and reimbursement is, so much from that.
All right, we are live on another web presentation. I'm really excited. It's Brett McHugh, CEO with ClinicGrower. We've got some amazing special guests today on our panel. I'm going to go through and introduce our guests in just a moment. And the topic for today is mastering vein practice growth, talking about proven strategies for patient acquisition and success. On our panel today, I'm joined by my brother from another mother, Brad Ferris, our Chief Clinical Officer, co-owner here at ClinicGrower. Also joined by Dr. Lawrence Schmetterer and Melyssa Leonard from one of our top performing vein practices based in Youngstown, Ohio. Dr. Schmetterer, would you mind doing an introduction, letting us know a little bit about yourself, and then we'll move to the panel?
Sure, Brett. I'm a cardiovascular thoracic surgeon. I've been in private practice for 32 years. My practice currently consists of thoracic and vascular surgery, and I've developed the vein practice over the past 6 years or so in an increasing fashion, thankfully, to ClinicGrower. We started out about, 4 years ago, building a website, trying to attract patients with venous disease and other types of problems for major surgery, going straight to the patients rather than relying on physician referrals, because at least in our community, a lot of the primary care docs had been taken up by the healthcare systems, and I'm in private practice, independent, and being not employed by a healthcare system, we rely on referrals, and we thought that a website would be helpful to establish a presence and attract business in that fashion. That, however, did not produce the results. You can build a website, but people aren't going to know to come to it. Moved on to a second media company that did a little bit more with some ads, but still we didn't have the concept of the landing page. And I was kind of struggling with the second company. And then I started getting prompts and emails from this company called ClinicGrower. And I said, this is not for me. And I said, no. You want me to keep going?
You said no, I can't believe that. Let's hear some more. We'll definitely dig into a lot of that. There's a lot to unpack under the hood of that for sure. You're right. I just checked a little bit earlier, it's going to be 4 years coming up in a few weeks. So we'll definitely dig into that in a few minutes. We want to unpack a lot because really today we're going to talk about those keys to success that we know you benefited from an attraction standpoint, converting patients, really scaling your business, which is something that, as we spoke about in the beginning, you had certain goals. And like you said, maybe you weren't very sure about it. I want to come back and really dig a little bit deeper on that. I do want to introduce Melyssa as well, Melyssa Leonard, part of your secret sauce and obviously key team member with your partner in growth. Melyssa, would you mind briefly introducing yourself?
Sure. My name is Melyssa Leonard. I am Dr. Schmetterer's practice manager. I have been with him since March of 2020. My first day at his office was essentially the first day of COVID, the shutdown where you couldn't do surgery unless it was life or limb. So a very scary time to be starting a new job. And from there, we have just taken things and grown from doing a couple of vein procedures and a few ultrasounds one day a week to basically 3 full days a week of ultrasounds because of the sonographers that I have there. And then also 3 full days of procedures. So it's just been a wild ride full of lots of learning and redoing and figuring out what the best way to use myself, Dr. Schmetterer, my sonographers, and the system to make things grow the way that they have. And it is so rewarding to watch it. I don't know how to even begin to describe it most days.
Oh, we'll get into it for sure. We'll describe it a little bit. Yeah, we're going to unpack a lot there because it's a tremendous growth story and there's a lot of keys to success that I think our audience is going to be able to benefit from the discussion today. And we've also got key panelists today. Brad, let's have you introduce yourself here from both your medical marketing backgrounds and obviously you've got a lot of hands-on experience from working not only with Dr. Schmetterer and Melyssa, the practice, the partnership, but also with a lot of other practices that we serve as well.
Yeah. Well, welcome everyone. So Brad Ferris, Bref's co-owner at ClinicGrower. I trained in cardiovascular surgery. It's a little different than Dr. Schmetterer, but that's kind of where I did my initial training coming out of nursing school. And yeah, I'm the mastermind and architect behind, how are all these patients finding the practice, right? How are we positioning Dr. Schmetterer and the team as rock stars and people that they should trust? And I think, we talk about influencer campaigns and, I think you guys have a very unique, interesting twist on how you put the faces of the practice front and center. You build that know, like, and trust. And obviously patients that are trusting, coming through the door, asking good questions, interested in the things that you're doing. We've helped build reviews. We've rebuilt that website, Dr. Schmetterer, right? And what was great about that was you really loved the look and feel of that website, but the functionality of it wasn't there. And we were able to keep that same look and feel, but really accelerate functionality overall. And when we kind of talk about that doctor everywhere, that's kind of you in your community, is the patients are seeing you and your team everywhere. They obviously have the choice to come see you, right? To go to see their primary care doctor. But we give them that direct opportunity to come directly in the door, meet the team, be assessed, and be given the option for treatment, which is exactly what you have.
Awesome. Yep. So I want to bring it back a little bit to Melyssa. You're right. You started your baptism of fire for you in COVID. We started working together right around the beginning of 2021, right around there. And so bring us back a little bit, Dr. Schmetterer, Melyssa, to, what it was like before, what you were looking for. Doc, you started to touch on a little bit as far as getting the emails. There was a certain stage of your business that you were at. We can talk about the tremendous growth you've experienced. Let's talk a little bit about where you were then, kind of the questions that you needed to have answered, because I know there's a lot of people that will be watching the content here, both, vein specialists, medical practice owners, because the things we're talking about are really key to growing a medical practice, not just a vein practice. And also we've got different employees within the vein industry from the sonographer standpoint, the RVT standpoint, that are just interested in the business of vein because that's what they're involved with. So if you wouldn't mind, just take it over from there and let us know a little bit about what that backstory looks like.
Yeah, well, we were getting our vein patients mostly word of mouth. We really didn't have much advertising, so to speak, some referrals. And as Melyssa said, we were doing probably about 3 or 4 ablations. And at that point in time, it was mainly radiofrequency ablation and venous seal, 3 or 4 every other Friday, I think it was. So we're only doing 8, sometimes 10 a month. And we were taking an hour for each patient. So we were doing it half day, 2 days a month. And when COVID hit, as anyone out there who's a vascular or thoracic surgeon would know, the ORs pretty much shut down except for life and death surgery. It just worked out that we're private practice and we controlled our own office and we took all the precautions and put up all the notices and took people's temperatures and whatnot. But we were able to conduct our business and not be shut down the way the hospitals were. So it just kind of worked out that we started accelerating our vein practice due to the ClinicGrower influence, and we had more time. And we started when there's more time, and then there were more patients coming in. We were able to grow the business that way. I think had we been no COVID, going full throttle in the main OR, doing major vascular and thoracic cases, I don't know if the opportunity to do more venous disease would have presented itself in that way, but that's just kind of a fortuitous circumstance. We had the time, we had the interest in growing that business, and then I kept receiving these emails from this guy named Brett, and it just seemed like a bunch of smoke and mirrors that they're going to send you patients and sign up, and it just didn't seem like it was. It seemed too good to be true. So the first time I said no. The second time, I think I talked to him a little bit, and I said no. And Brett is persistent, and I have to say that his persistence is kind of like Melissa. Yes, Melissa.
You had a conversation with Brett, and then he called me, and I had a conversation with him. It was quite lengthy because I was leaving the office. I got a message from him, and I'm like, what is this? And I'm like, I remember telling one of the other girls, I'm leaving. I'm getting ready to get in the car. I'm driving home. I've got to go to a baseball tournament with my son. I'll talk to him in the car on the way there. And I talked to him, and he's telling me about the service. And I'm like, this sounds like cold calling, telemarketing, all the things that I don't want to be involved in. And I remember even coming back to you and saying, like, I hear what he's saying, but this sounds real telemarketery. And
Sketchy.
I don't know about it.
Yeah. So some time passed.
Kind of like,
Some time
did
passed
you know
after that.
the value of that follow up and that relentless desire to really to help someone, right? We knew what we could do from working with practices like yourself, and that follow up for sure, that ability to connect with people. Like, I thank you for putting me under the bus here with my pursuit of working with you all. But I think we'll definitely talk about that, right? I mean, you went from, okay, what's this company doing? Used to the referral business, and growing a practice traditionally, the traditional way, kind of before digital. Let's talk a little bit about, Doc, I think you mentioned before doing digital marketing strategies, which we'll dig into. I mean, you're doing about 8 to 16, so in that realm of procedures per month. When we first started to introduce digital, number one, what we like to build on a foundation: website, advertising, SEO. Let's talk a little bit about what it was like to see the results there. What was that experience like for you? Because we know on our side what it's like to build the infrastructure and the importance of website. You actually had a website already, right? But remember you said before that the traffic wasn't necessarily coming there, and you had these things, but they weren't really connected. So Dr. Schmetterer and Melissa, would love to hear what it was like when we connected these different ingredients from a digital standpoint.
You mean like when we first went live with Growth Express and the ads started and so on?
Yeah, I think the ads is a good place to start. We talk about the advertising component because that's typically quick. And then we'll dig into some other components and hopefully educate some of the viewers here on just it's not just one thing, but there's many, important ingredients when it comes to actually attracting patients, people into the practice. But Melissa, go ahead with the advertising. That'd be great to get your experience in that.
Ads started, we went live and the ads started coming in. And I still can tell you the very first patient vein screening that I got. I can tell you a person's name. I can tell you where she worked. I can tell you how many procedures we did on her. It became almost like a drug. That vein survey coming in, it would pop up on my phone and I would have to immediately look at it. And I would immediately be contacting this person. It became this thing. And I remember saying to Dr. Schmetterer, I remember sitting there having my phone in my hand and that popping up on my phone. And I said, well, what do you think about finding like Chromebook, just so that I can have access to this anywhere, anytime, and I can have access to the schedule at the same time? And he's like, I like it. Let's do it. And that's how it started for us, that when he tells people, and he literally comments on our Facebook ads all the time, call Melissa, text Melissa anytime, she'll get back to you. And that's how that started. And I get back to them all the time during the day, while we're working, in the evenings, on the weekends. And so many times we have patients come into the office and they say, I've never experienced anything like this before. You guys are available to me all of the time. And I say, yes, we do our best. Obviously, we all have lives and things. And I start messages with sorry for my delay sometimes. But that has been like the really cool thing about this, is that I don't have to wait to come into the office the next day to reach a new lead that filled that out at 6:30 in the evening. I'm reaching out to them when they are available. And that I think has been one of our biggest helping factors also is that growth is not a 9 to 5 job. Growth is an all the time job, especially initially.
Absolutely.
So-
Absolutely. When it comes to that, the growth aspect, one thing that we found, and I'll, ask Brad to talk a little bit about the background here as well. Creating that vein screening, that educational process to educate patients, number one, with the growing rates of varicose veins, venous insufficiency, there's the biggest challenge continues to be education in the marketplace. And so the platform that you just discussed there a little bit, Melyssa, meta ads, the ability to go into to reach patients and educate them and create that awareness and get that interest through the online vein screening proved very, very important, of course, and a major source of leads and appointments. But Brad, take us back a little bit to creating that vein screening process. And also, I'd love to hear your experience from working with Dr. Schmetterer and Melyssa and also other practices on the growing importance of that content that's educational and inspirational in connecting with patients and getting them into the practice.
Yeah. Well, to start with the vein screening, it's actually quite simple, right? Varicose veins are something that most patients can see and feel, right? They know that they have it. They just haven't taken action, spoken to their primary care provider about it yet, and have done a whole lot of research. So the survey is really, designed for someone like Melyssa, understand their symptoms, right? What is their happiness like? What is the pain like? What's the achiness like? It's conversations. And of course, when you have a patient who's very symptomatic and that patient is talking to someone who is as patient focused as Melyssa, well, now that patient starts to look at the reviews. They start to look at the website. They are maybe potentially seeing the testimonial on the ad. Well, now Dr. Schmetterer becomes, almost what he had said is almost too good to be true too. And Melissa's inviting that patient through the door. So I wanted to kind of just say Melissa too, like, I know there's a lot of people probably watching and going, what do you mean you contact patients outside of office hours and when it's convenient for them? You guys still have your office hours. You still have your, internal procedures, but you're very, very patient-centered, meaning that if a patient wants to have a conversation on a Monday afternoon or potentially even a Saturday morning, that availability can make the difference between them researching, like you said, Dr. Schmetterer, a hospital-based program or a competing practice. It's really understanding that once you capture them, you don't want them calling someone else, right? You want to still have the best reviews, the best marketing, the best infrastructure, but also the best people. So I think that's where really the survey, that's just an initial kind of piece. We obviously do a lot more that we're not going to necessarily share all the secrets tonight for Dr. Schmetterer that, he's got either designed proprietary or he's done really, really well in following our instructions. But that's what I would say on that piece. And then the second piece was.
Yeah, just, we did a recent webinar about how to educate, inspire, and attract new patients. And one of the many things Dr. Schmetterer and Melyssa that you really embraced is while we're running ads on those different platforms there's an importance of that personalization. So Brad, really, with that piece, with the personalization, with Dr. Schmetterer and Melyssa, with, creating that content, doing some of the things that can be challenging for business owners and doctors to get on camera, to have those photographs. I'd love you to take that to the next level.
Yeah, no, I mean, this is one of the secrets, but it shouldn't be a secret. Dr. Schmetterer and Melyssa do a really good job. Their team does a fantastic job on the social media side of understanding where patients' fundamental desire is. They want to feel better. They want to look better. They want to be better. And they do a great job of inspiring that patient to reach out, right? How do they do that? Doc, it's you. We know that you're going to look fantastic on Valentine's Day, right? I know on Valentine's Day, you're going to be on that Friday, looking you're taking pictures of patients in that day, right? Your patient leaves a review. You're bringing them in for a hug. You're bringing them in for a little bit of a close relationship and rapport. We're still professional. We still have boundaries. We need to have with all of our patients, but there's that little bit of that human element that's there, right? They do know you well. They know the dog's name. They know about Dr. Woods. They know about the different staff members that are in the practice. And those tiny, small, little human moments, I think is what you guys are really, really good at capturing. It does make a difference on where the patient's going to choose to do care. They have options, right? There are places for them to go. But when you can make it easy, right, you can make it inspiring. The intent of that patient was always there. Well, now their decision is almost like a stand-up, right? And just like a good sports team, you guys are practicing. You understand, positions and game and strategy and all of that. but the patient just sees a great experience. And I think, largely when we can market a great experience, it's kind of like show and tell. You're kind of saying to the patient, here's what the experience is going to be like. We're going to tell you what that's going to feel like. It's almost too easy for the patient to say, yes, I want to proceed.
I'd like to say a little something.
Go for it.
Yeah. So if I was sitting in the audience watching this, one thing that I would be asking myself would be, yeah, all this sounds good with the marketing and getting the patients to like you and so on, but how does it work? What is one of the steps that makes this thing happen? And if I go back to my first and my second foray into social media with two previous companies before I met ClinicGrower, they built me a website and they were doing some ads, but there was no traffic coming in. And I went to them and I said, there's got to be a way to send ads to people that I was trying to describe a landing site and I didn't know what it was. I was trying to describe a way to get people to go to a site and start clicking on things, maybe go to the website, maybe call for an interview. And I didn't really know what it was called. And then when I got to see how ClinicGrower worked, I realized that their ads, they bring interested patients in an engaging way. And I must say that I think a lot of thought went into creating these ads, and I think a lot of testing went into creating these ads, and they're incredibly effective. And the same ads have been running for years, and it works. It's an enticing ad, and people click on it. And once they click on it, they're drawn in, and they start giving information and answering questions. And the next thing you know, they're connecting with Melyssa through the website, through the ClinicGrower software, which is a proprietary software.
We do new stuff. Tell everyone about the fun experience you had this week, kind of running around the practice, showing everyone was rock climbing, right? And they all thought you were sharing the rock climbing video, but you were sharing your ad.
I mean, these are the fundamentals, but there is icing on the cake. Okay. And some of the icing, jumping to the other end of the spectrum, is that I was just looking at a reel, and it was somebody doing a parkours where they're climbing a building just by jumping and using their arms and legs. And I looked down at the bottom of this reel, and there was my practice, my logo and my name and something about veins. And if you click on it, it immediately takes you to the link, information about venous disease, and prompting you to click for more information. And if you click a couple of times, next thing you know, you're talking to Melyssa. And this was at the bottom of an Instagram reel. I didn't even know it was going to be there.
They brought it to me and I was like, you want to do this? Like, what wall are you climbing?
Yeah. And
he's like, no, look, down here.
Yeah. But when you work with ClinicGrower, they push you out. They push your information out literally everywhere, and people just see it and they start clicking on it. And there's a funnel, and they come through that funnel. And in our practice, the way we do it, it goes straight to Melyssa. Now that may not be every practice. Some practice may collect the information overnight, and then when the staff comes in the following morning, they go through the new patient acquisitions. Melyssa does it live as they come through, which is extremely effective, but there's different ways to handle it.
Love it. And, you touched on a couple of things there as far as, with the fundamentals, the mechanisms to attract new patients. So the funnels, running ads, and also the element of when those leads come through, what's happening next. And so when the leads come through, there's, combinations of automation, Melyssa, speaking quickly and really developing those relationships with patients. Would love to hear a little bit about what that looks like, that conversion piece. We spoke about having a website, and we enhanced the website, really harness the SEO. So for patients in the marketplace that are actively searching, creating the awareness through the ads on Instagram, on Facebook, using the proven ads, and also constantly innovating with different innovative techniques like you just mentioned there. Actually, before we talk about the conversion piece, never really asked you this question before, but as we ran the ads, what was it like? Did you give us feedback from, I've seen you, your brand, your celebrity status perhaps in the marketplace. We've seen the patient testimonials and so on and so forth, but I just wonder what that was like for you from, not really doing much advertising to then, starting to appear everywhere in front of those targeted audiences. Did you notice that? Was there a kind of a pickup or celebrity status that you noticed?
I wouldn't use the word celebrity, but what I will say is that early on, as patients would start coming in, I would typically ask, well, how did you hear about us? Yes. they'd say, well, I was scrolling on Facebook and there you were. And it was interesting. And sometimes they would say, well, you've been popping up in my Instagram and my Facebook, and you just kept popping up. And finally I said, you know what? I have to do this. And so, yeah, that was it. Patients just commenting that that's how they found us. What was it like? Well, I didn't feel like a celebrity. I just felt grateful that all of this worked. And I must say that up front, when you start paying for ads and, paying to have yourself pushed out there, you think, well, is it worth it? But then when you realize that one patient responding per month pretty much pays for all the ads, it's uncanny. And then it's quite a good return on investment.
There are, and I'll piggyback off of that a little bit. There are one of my, and I guess this is my hot take, secret tip of things that I do, is I have a lot of success on Sunday afternoons. So every single Sunday I sit down and I send reminders for the entire week. I schedule the text reminders to go out to the patients for their appointments for Monday through Friday. And when I finish that, I go back through people who are sitting in my steps of the funnel, or people who have no-showed for an appointment, or people who have canceled an appointment. And I shoot them out a text that says, hey, this is Melissa. I'm just circling back to you or following up with you on a vein survey that you filled out quite some time ago. We're in network with, I use those pieces that come from the vein survey. I am sorry that you are suffering with pain in your legs and unsightly veins. The good news is that we can help. We are in network with, and usually it says Medicare, private insurance, Medicaid. We are in network, and I specify that to that person. We are in network with Medicare. Typically, they cover the procedures that are done in our office. We can have you looking and feeling better in no time. I look forward to speaking with you and getting you scheduled for your consultation. And I can literally send out 100 texts, and sometimes I get 1 or 2 responses. And those days when I do that, it is so frustrating sometimes when I'm sending those out and nobody's answering me and nobody's answering me and nobody's answering me. But then someone answers and they are scheduled for a consult that week, and they end up being a really good quality case. And I'm like, oh, well, those hours that I was sitting there, watching TV and just shooting those texts out were so worth it, because this one patient made that all happen. And the amount of, billable services and reimbursement is, so much from that. And that's one of the things that I feel like you have to figure out. What helps you get the response that you are looking for? What do you need to do to get that response? And what I found that I needed to do was reach people when they were available.
If I could pitch in there and give anyone watching a helpful tip. You're exactly right, Melissa. Sometimes we forget in the Monday to Friday, 9 to 5 of the office, that we're reaching out to that patient when it's convenient for us, right? There's a patient that we just checked in. We've got a little bit of break in between something else. We're reaching out. That may be a really convenient time for that patient to answer. It may not be, right? They may also be at work. They may be dropping the kids off. They may be on their way to an appointment. Sometimes even just having the mindset of, well, we're definitely going to still reach out when it's convenient for us. Are we available when it's convenient for them, right? That is definitely something that is 2025 in most competitive markets. That mindset does make a difference.
I'll say a lot of Melissa, and I see when I log on, I can see all the messages between Melissa and the patients. And if I have the time or the interest, I can actually listen to the recorded phone calls, because everything goes through ClinicGrower and it's all there. And I know that early on, in our experience, Brad would be monitoring our practices and commenting on it. And there were even some, secret shopper calls where ClinicGrower staff would impersonate a patient calling in to test us and see how we were doing. But what I was saying is that I can see the messages that go back and forth between Melissa and a patient. I have to say, it's almost like two friends texting each other back and forth, and it's not about, the mundane things, but it's like, well, when's a good time to talk? okay. And the patient will typically say, well, I'm dropping my kid off at practice now, and then I have to go to the store, and then I might be free later this afternoon. And Melyssa says, well, let's, put down the time. Okay, I'll call you then. And it's like two friends conversing about when they're going to hook up, when they're going to talk. And it's a lot of messages go back and forth to establish and maintain and move the contact forward and move the ball down the field or through the funnel, or however you want to look at it. And it's that repetitive communication, the little repetitive contacts that bind the patients to our practice and end up being a conversion to a consultation, to a series of procedures. As anyone out there in Zoom land knows, if you're already running a vein clinic, if you're doing Varithena, one patient could lead to many, many procedures. So a lot of effort goes into each patient, because each patient is very valuable, not only for their business, but we live in a small town. A lot of people know a lot of people. Word of mouth travels quickly. And Melyssa could testify, because her memory is a lot better than mine, how many patients have referred other patients from the local university to the hospitals, to the police department, to the factories and the businesses. We see people constantly coming in just by word of mouth from patients that have come in, say, through Facebook, and now they're coming in through word of mouth, and it just grows. And the word of mouth is so effective because of the relationship we established with the first patient, the one that came in through Facebook, and then it just grows from there.
Yeah. Well, so much gold there. I mean, just to, kind of parlaying from what you said as far as the relationship, and Melyssa, the work ethic, the diligence, the relentlessness that you've shown by really appreciating that relationship and the value of each patient. Like you said, sometimes it's not that first message, but it might be the second or third. Just letting them know that you're there, that you're checking in, using that personalized conversation, understanding what they were looking for, the insurance, as you mentioned, that comes through the survey, understanding what their characteristics, understanding them, getting on the same level, the same page as them. I think that there's a lot of value for anybody who's, watching this or listening to this, just in that piece, is really understanding the patient, as Brad mentioned earlier, understanding what they need, not pushing what suits us, but really understanding that patient journey. And then we were discussing a little bit as far as, what that means along the way. You mentioned earlier, Dr. Schmetterer, I think initially you were doing around about 10 procedures a month. And, I think recently you've been in good months over 200, but averaging over 100 procedures per month. And that's got to be transformative for your practice. And there's a lot of people that have got in touch about this content that maybe they aren't there just yet. But it's all these blocks that we've been discussing as far as making sure that you do have marketing working for you, that you're delivering an incredible patient experience, as you all are at the practice. And one thing I really want to emphasize is the amplification effect. It's not just about we spent $3,000 on ads and we got 40 patients. It's about really increasing the number of referrals that you mentioned. I think that's really key, because the best type of patient, the best type of customer is going to be that word of mouth. But the best way to amplify that word of mouth is to use marketing so that you can increase your reach, increase your clients, increase your patients, and then deliver an incredible experience. So guess what? They will tell their friends, they will tell their family, they will tell everybody at the police precinct, they'll tell everybody at the hospital, they'll tell everybody at the hairdressing salon that Dr. Schmetterer and Melyssa give me a VIP experience. I'd love to hear maybe taking that to the next level. Maybe even Melyssa, Dr. Schmetterer, because it goes through Melyssa before Dr. Schmetterer sees the patient, is what that experience looks like. From that inquiry coming through, Melyssa, you spoke to the patient, you got the online vein screening, and then we're going to talk a little bit about that conversion piece, right? Because it's somebody from the internet, and then we're going to get towards that procedure. I'd love to hear your experience of how you deal with that.
Sure. So, when we first started using it, obviously we did all the online things, read all of the information. And the part of it that, still resonates, that we still use, and I use it, I think I used it yesterday in the meeting with you, Brad, is the know you, like you, trust you. And that is ultimately what I do with these people. They know me. By the time we're at the end of their treatment, they know that I have kids. They know everything, because they'll shoot me a text and I'll shoot them back. Hey, give me just a few minutes. I'm doing this. So that is the very important part, the human aspect that one of you mentioned earlier. people connect to that. They want to watch your social media because they want to see that you are a real person. They like to see you doing the silly things. They want to learn your content, but they want to see the silly, fun stuff as well. They want to see that you're human. They want to, come in and see our office dog laying under the desk. On days that he's not there, they say, but where's the puppy? You know what I mean? They see him on our social media. They talk to me. They come in. They're at all that thing. So I convince them that they like me when they fill out their vein survey, and I text with them or talk to them. And then by the time they come in, they say, oh, you're Melyssa. It's so nice to meet you. And we get them into the room, and then they meet Dr. Schmetterer. And between the two of us, we have made this relationship where by the time they leave their consultation, Dr. Schmetterer and I are their friends. And then we introduce them to our friend, either Christy or Jamie, for their ultrasound. And Christy and Jamie become their friend. And by the time they're done with their treatment, they know all of us and they know what it is. And that brings me to, I've said it a million times, Dr. Schmetterer and I were talking about it this morning. I am a big fan of keeping your team small. Keep your team small, figure out what employees can hack it and can do it at what level and doing what job, and go from there and branch out that way, because the patients love that they come in with their vein consultation and they talk to me. They come in for their consultation and they do their scheduling with me. They come in for their procedures. I mean, and at one time I was going into the room and doing every procedure with Dr. Schmetterer as well. So they knew that Melyssa was in the room with them during the procedures. I've had the procedures myself so that I can tell them about them. Everything that is done, it sort of comes through me and Dr. Schmetterer and one of our sonographers, down to their insurance authorizations and the scheduling of their procedures. So everything is very personal and is very on a very specific level, that I'm not saying, oh, you come in and do the consultation, and then I'm shooing them off to somebody else to schedule their appointments. And then I'm like, Susie downstairs is going to call you with your insurance information. It's much easier to take that you've got a $1,500 deductible from somebody that you've already met and you like them than it is from Susie down the hall in the closed door that you don't know. And she calls you and says, so I checked your insurance and it's going to cost you $5,000 out of pocket. Let's get you scheduled. Somebody's going to say, whoa, maybe not. But if Melyssa calls that already talked to you and, oh, I hear, the baby crying in the background, how's she doing today? You already have that personal relationship. By the way, your insurance pays at 90% after your deductible. So, these procedures are going to cost X amount of dollars. And they're like, that's inconvenient, but okay. It's a different ball game playing, I'm a sports girl. So we are playing small ball. We are playing small ball in a big arena.
Well, Dr. Schmetterer, did you have something to add there?
Yeah, I wanted to emphasize the added value, the importance of having your contact person, your Melyssa, understanding the insurance. And Melyssa, I know it sounds too good to be true, but Melyssa handles every single insurance authorization and is the one to do battle with the insurance company. And she has intimate knowledge of every insurance company. And it started out, you had a cheat sheet for each insurance company that, you had to refer to, and now it's all internalized. But her knowledge is invaluable to the patients and securing the patients. And when I'm in the room with the patients, I have on my paper, I have what their insurance is supposed to be. Sometimes it's not even updated, but they ask me, is it covered by insurance? I sometimes know for sure, and sometimes I'm not sure. And I say, well, don't worry. In about 30 seconds, when we walk out of this room, Melyssa's going to have the answer. And if she doesn't, she's going to get it for you by the end of the day. And that's so valuable because, as Melyssa said, she's already established a rapport with the patient before insurance ever came up. And then she's got the information for them. And that's so valuable in keeping their trust and ultimately making that conversion and booking treatments.
Basically, Melyssa, you were talking about the sports analogy, playing to win, and Melyssa's laying them up, and Doc, you're slam dunking. A couple of really important things there as well would be, Number one, it's that congruency, that rapport that you build, the congruency, that there's nothing disjointed along the way. You've got a close-knit team. Everybody's on the same page. And that shows. We see it in the social media, the engagement. We see it in the patient testimonials. We see it in the results that you're getting, of course. And Melyssa, you mentioned some of the other team members. Would you mind sharing with viewers, listeners here, just a little bit about that culture that you've established? It's a conversion culture. It's a culture that's designed to help people in your area, in your market, to get treated, to look better, to feel better, to be better versions of themselves. Would love to hear your breakdown of how you've assembled that culture and grown it.
We were very lucky fairly early on in the growth process to, unfortunately our previous sonographer contracted COVID, and Dr. Schmetterer knew that I had a full day worth of ultrasounds on, that was on a Saturday, and on Monday he knew that I had a full day worth of ultrasounds. And I think he probably was thinking in his head, I can't call Melyssa and tell her that our sonographer has COVID because she's probably going to have a stroke. So when he called me, he said, so-and-so has COVID, but I got somebody else, and I'm going to need you to meet her at the office and show her what to do and go from there. And so we were lucky pretty early on to snag a sonographer that is extremely good at what she does. We have two of them, but the first one that we snagged, she has a lot of experience and is so good at what she does. And she was right on board with wanting to grow the way we did. So we were able to, the three of us, work together to say, well, this is how we've been doing it. And she said, but I need it to be a little bit different. And we were able to work together and create a process that was efficient for her as the sonographer, that was efficient for me as the practice manager, and was efficient for Dr. Schmetterer. So we were very lucky to find that piece. And then she brought in somebody that she knew who is also very talented at what she does clinically, as well as just, I've got a great team of personalities as far as that goes. And all together, we just create this team that continues to build the rapport and build the relationships and find the venous insufficiency that we can treat. From there, we figured out what the best team to have in office all the time seeing the patients was, and how to best utilize the staff, whether it be on a medical records level, doing, dictation and things like that, or having FaceTime, in the room with the patients. And we figured that out. And we went to where we had a couple of other assistants that were in the room. Like Dr. Schmetterer said, we were taking an hour to do an ablation. We had two medical assistants in there, and I went to him and I said, I think we can do this more efficiently, and I think I can do it. So that's where we sort of pivoted into that, and where I would go into the room, and then that made these patients feel comfortable. Not that our other staff didn't, but it was just that continuation of care that they knew you, they were comfortable. And then as we grew, I remember saying, I can't do it all. I can't do every single procedure. I can't be out here to help you get people scheduled and be in the room to do this. So we added, I think one of the last key players to our team, our medical assistant, Jalen, and she is so nice to the patients, and they love her now. And now it's sort of, if I walk into a room to help with a procedure, they're like, oh, you're in here? Because they're so used to her. We also have a great front desk girl, Jessica, that occasionally a patient gets a hold of the phone number that actually rings into the office. It's on our business card. You Google it, it comes to my cell phone, even though they dial that number. But if they dial it directly off of our business card, it comes in. And we've got Jessica at the front desk. She greets them after they sign in on our iPad that we use, and gets their insurance information, and is that smiling face at the front desk, and is just great on the phone with them. And that's really our cohesive little team, and everybody is in it to try to make things better. And anytime change isn't comfortable for anyone and no one loves change. But anytime I go to them and I'm like, so we've got to like kind of switch things around a little bit and do something different. Although they may not love it, they embrace it fairly quickly because, we're all about efficiency and making things the most comfortable for the patient, and then essentially, trying to make our work life more efficient. And it's a great team. It's a small team, like I said, and I can't imagine it any other way.
Beautiful. I'm excited for, it's incredible what you've achieved. I'm excited for the, for the future for you all as well. I mean, really, for anybody who's been watching, listening, seeing the replay, we really went through it from soup to nuts in a lot of respects, from the attraction, really going from building the infrastructure from a digital standpoint, how that generates the awareness, the interest, attracts patients, the nurturing that you've been doing, Melyssa, with the tools and technology, and the conversion piece as well. So I think everybody's going to find that extremely valuable to gain some insights. As we kind of start to wrap it up here, Brad, I'm going to just check with you, and I'm sure Melyssa and Dr. Schmetterer will have some really good insights here. We work with practices all across the U.S. Not everybody is succeeding at the levels that Dr. Schmetterer and Melyssa are. Brad, what are you hearing are some of the main challenges or those growth inhibitors that the other practices or roadblocks that they're experiencing when it comes to growing their practice and attracting new patients? What are the things that we just discussed?
I think one of the challenges for established practices, I would say even kind of medium term practices, many practices that have been around for 10 to 15 years, is they love the referrals. I mean, you guys love referrals. Most of my colleagues love referrals. And we sometimes, forget that, that referring colleague has spent a large chunk of time building up our reputation, talking about why they send patients our way. Maybe even, in this instance, we'll start talking about, a specific kind of touch point or an experience that patients had, and really kind of building a lot of trust, right? And when that referral shows up, 99% of the time, we sometimes take that for granted. And when we're putting out an ad, we're starting from scratch. That patient may have never known that Dr. Schmetterer and Melyssa ever existed. So the quality of the ad, what the market, the media, right, the messaging that we've got there really matters. And one of the biggest struggles we're also trying to accomplish and overcome is how do you build trust that patient, with a family doctor, has been with that family doctor for 20 years. That doctor refers them somewhere. It's almost implicit that the trust is there. In this instance, there is none, right? So the fact that Melyssa is available, right? I remember back in the day, I have a picture of you caught on the beach messaging a patient, right? That is an example of building trust, right? When Dr. Schmetterer will do his Valentine's Day photos, it's an opportunity to build trust. And, an ad can't just replace that, right? You can't just throw up a stock image with an offer and expect it to be as good as the awareness and the branding and the relationship that seeing Dr. Schmetterer with a patient beside him, smiling, beaming, right? Like beaming is the nice, that goes a long way. It doesn't bridge the gap completely, right? But it gives Melyssa that opportunity to take that trust and then kind of keep building it and move it on. So I always explained to Melyssa early on, right? It was like we were on the relay team, right? I got the baton, I'm passing it to you. You're excited to take it. If we drop it, a lot of practices drop a lot of batons. Doctors like Dr. Schmetterer look at the ROI and go, there's a lot of stuff laying on the floor. What happened here? And, sometimes just making sure that the team is working towards that goal, right? Is everyone working towards letting that patient know what the experience is going to be? And it takes time. Melyssa, there's a lot of explaining to patients. There's a lot of building. But as you guys are aware, the ROI is there to invest that time into the practice. And we may have lost touch with that a little bit in medicine, right? Sometimes we are a little too provider centric. These are our hours. We lock the door at lunch. Things that we don't think make a difference. And patients really do love that patient-centered approach. They like being the VIP. They like the red carpet, right? They like coming into the new, you guys have beautiful new practice, right? Those are all things that they kind of enjoy, right? They kind of want to feel special. And I think for a lot of the practices we stick with, the experience of that patient coming maybe from a cold channel, coming from a website, you may be speaking to that patient in a way that you don't realize. And I think one of the things that Melyssa and Dr. Schmetterer do well is you guys are very keenly aware of how your practice is positioned, how people view it, and you actively take interest and pursue every patient. Like, what can we do to make this world-class experience?
I want to amplify one thing that Brad just said, which he had spoken to me right at the beginning, which is, as a thoracic and vascular surgeon, patients come to me with limb-threatening ischemia or a lung mass, and they're scared when they come in, and their primary care doc has referred them to me. So they're coming in basically being told this is the guy that's going to help you. All right. And it's nothing like that in the vein business. For one, the primary care docs generally don't understand the symptoms and signs of venous insufficiency. They're really back in the 90s where it's got to be big ropey veins and the only thing you can do is strip them, and it's a horrible procedure, and just wear stockings. That's pretty much the start and the finish of most of the primary care docs. Now, the ones that have gotten to know us, they understand increasingly the signs and symptoms of venous insufficiency far beyond just miserable varicose veins, and they understand the minimally invasive approach and whatnot. But getting the patients to trust us through the ads is key, and then building that rapport with them. One of the first things I say to them is everything that we do is going to be in this office, from the ultrasound to the treatment. There's going to be no hospital. There's going to be no incisions. There's going to be no pulling veins out of your legs like we used to do. And they're all very happy to hear that right from the start. So I just want to make the point that these people are coming in without any expectations. All they've seen is the ads, and then they've had a nice experience with Melyssa. And it's my job to push it over the finish line and convince them that we understand what we're doing and we're going to take care of them. And then they want the treatment.
Appreciate that. We're getting close to actually up on the hour here. I don't think there's any questions coming through the chat, but would love to, just to maybe to wrap it up, Dr. Schmetterer, any pearls, any final pearls of wisdom or nuggets of advice that you might give to a colleague, somebody who's growing a vein practice, looking to grow a business, anything that you might, any parting words you might leave us with? As
far as ClinicGrower goes, follow their program, do the learning modules. It's a good basic education in how to treat people and how to be a salesman. And to piggyback on what I just said, as a thoracic surgeon and somebody's coming in the door with a lung mass, I don't really have to be a salesman. They just want help. They just want to hear that they're going to live. Okay. The vein business is totally different. You have to understand what they're concerned about and explain to them, make them feel that you understand their concerns and that you're going to solve their problems specifically. And this is easy to say, but it's reinforced through the ClinicGrower modular training. All right. So the fundamentals that ClinicGrower will train you on are perfect place to start. And then you get into the icing on the cake. You get into learning how to play with social media. And ClinicGrower has some wonderful company that they've referred me to handle the postings on the different social media sites and to do the editing and the ad creation. So I don't have to do that. Melyssa doesn't have to do that, even though we create our own content. They'll give you the foundation and they'll give you the icing on the cake or refer you to the people who do it. But you make the style and the feel of the practice your own, and it's what you're comfortable with. And not everyone's going to find a Melyssa. You may be a 9-to-5 practice where you look at all the patient calls that came in overnight and then answer them, and you're gonna find your way to do it. The more you react to the patients and bring them in, the speed with which you react to them, and the personality that you show them, the more success you're going to have. So that's the dial that you have control over. ClinicGrower will send the patients your way. There's no question about it. But once they get to you, it's what you do with them and what your staff does with them that makes all the difference in the world.
Great. Thank you for that. Yeah, definitely work involved in growing a business, no doubt. Melyssa, how about you? Any parting word?
I would just piggyback off of that a little bit. I 100% agree. I tell Dr. Schmetterer all the time, whether it's the ads bringing the patients in or whatever, the proprietary software that we have from using ClinicGrower is something I can't live without. You could probably pull up real quickly how many text messages I send a month through that proprietary software. That helps keep me involved and organized and knowing where everybody is and what everybody's doing and answering things. Because if I'm on the phone and somebody has a quick question, if they call in and I can't get to them, it's popping up on my screen who they are. And I can shoot them out a text. Hey, Bref, I see you're calling me. I'm on the phone right now. Can I help you via text? The software is hands down one of the best parts of it. And then to piggyback off what Dr. Schmetterer said, the learning modules are fabulous, but making it your own is where you're going to see your success. You have to take what you're given and figure out how to apply it to your life and how to apply it to real life and how it's going to work to grow your practice. And like Dr. Schmetterer said, there's not every practice that's going to have a me that's committed to it 24 hours a day, 7 days a week, but it depends on what type of growth you're interested in, whether you're interested in finding that person. If you're okay with 9 to 5 growth, then you may have your key player in place. If you aren't okay with 9 to 5 growth and you want something more, you may have to find the person who is going to be your 24/7 growth person. And that's okay too. It's not saying that your team isn't ideal and isn't wonderful. It's saying my team is great, but I need somebody or something to take me to the next level. And the something is the ClinicGrower, and the somebody is the person that is willing to eat, sleep, and breathe your practice's growth. So it's definitely all very dependent upon how you use it. The tools are there. Everybody using it properly and being cohesive and being on board with growth is what is very important. So you definitely have to have your whole team on board with growing, not half of your team going, oh my God, they added another patient. So I guess that's my big takeaway from it is build your team around the type of growth that you want. Use the tools that you're given and make it your own.
I love it. I love it. In fact, we just, Brad and I finished up an exercise, part of a development program that we're going through at ClinicGrower today. And at the center of it, which just what you were talking about, Melissa, is, having a plan, having goals, and then having people number one, that they get it. They get your goal. They get your vision. They want it. They're bought in. They want to achieve what you want to achieve for your business, to grow together. And they have the capacity for it, the skills, they're committed, etc. And also one of the things that you mentioned as well, which is, hey, it's not a one size fits all. Every business is different. Every practice is different. Markets are different. So customizing the tools and using the tools as you need to use them for your area, for your practice, and to realize your goals and your plan. Dr. Schmetterer, Melissa, Brad, thank you so much. Like I said, there's really no silver bullet. There's no one size fits all when it comes to mastering vein practice growth. Dr. Schmetterer, Melissa, I think we can safely say that you have mastered it. You've delivered so many nuggets here today. We're going to be able to share this with different colleagues in the marketplace. And again, can't thank you enough for joining us this evening. Really grateful for the time that we spent together and also the partnership that we have. So thank you very, very much.
You're welcome.
Thank you, Bref.
Thank you.
All right. I don't think we have any questions. So Melissa, Dr. Schmetterer, thanks so much.